Wow, it looks like you guys made it all the way through the end. I want to recognize my collaborator, Dr. Robert Merja, and we're going to discuss treatment of facial wrinkles using a 1550 nanometer erbium YAG laser with a novel sapphire-cooled window and intelligent scanning pattern. So the background was to use this new and novel laser. We know the 1550 is efficacious for the treatment of wrinkles, and it targets water. Fractional lasers concentrate energy into small columns in the dermis. And also, this novel device offers multiple delivery tips, a cold compression scanning tip, which provides epidermal protection and a higher density and can allow us to go into deeper coagulation zones, and a roller scanning tip for lower density and increased treatment speed. So the study design was a multi-center prospective IRB-approved study. We used this device, which was a prototype. We had 40 subjects. They had facial wrinkles, up to 3 treatments, and 1 and 4 month follow-up. And the follow-up that I'm going to present is mostly the shorter term follow-up, the 1 month, but we are waiting a 4-month follow-up as well. Here's a picture of the test device. There's a rolling CCT scanner and a compression CCT scanner. And you can see on the left a normal condition, and then after you compress the skin, this has a sapphire cooling window, so it's very cold. And you can see that the idea of compressing may be to reduce the amount of water and blood so that we can get into a deeper zone. Here was the treatment technique. We used the cold compression scanning on the high density exposures in areas requiring the greatest intensity, that is where the wrinkles were, and the secondary areas, which were the broad, mainly the cheeks, with rolling scanner for speedy and efficient treatment, and the treatment times was mostly just 20 minutes. There is an AI component to this, so an age-old problem is that with fractional density, it may be limited. There is two-dimensional scanning, which can reduce risk, but bulk heating and PAH is always a risk, and it can limit exposures at higher energies, especially in skin of color. So the solution is a 3-dimensional so-called controlled chaos technology. So there's an AI-based algorithm that controls the spatial time distribution and depth of each pulse. So if you see on the right all these dots, where the high energy, 70 millijoules, is a red dot, the medium energy is blue dot, 50 millijoules, and the lower energy, which is 30 millijoules, is a green dot. And then you can see this inset where you just see that it's dispersed based on depth and spacing so that the heating is not going to cause bulk heating and PAH. And this is just a visualization of a biopsy showing the different energies. So you have the shorter energy on the right, or the lower energy, the medium energy on the left, and the deeper energy in the middle. Here is immediately post-treatment. You can see erythema, edema, and a fine sandpaper texturing. We did have some pinpoint bleeding. And redness typically goes away very quickly within 1 to 2 days, as well as the edema. Here's a patient from my site who had very good results. We thought this is after only 1 treatment. And again, only 1 treatment. Hard to get those wrinkles on the medial cheek, especially with a non-ablative treat device. Here is another patient in our study. I don't know how well you can see it, but it was surprising because we have found that 1550 doesn't usually cause too much tightening and also doesn't usually help that much with pigment, which wasn't our goal. But you can see in this patient that she had wrinkle reduction, some tightening, and also some reduction in pigment. Another patient with similar outcome after 1 treatment, especially in the wrinkles around her eyes. This is a 3D picture of the best outcome that I had in my study, but this is a pretty impressive result, I thought, for one treatment in these wrinkles around the cheek, and you can definitely see a reduction there. So the results were that all subjects successfully completed treatments. The final 90 or 120-day follow-up is pending. The blinded physician photograph evaluations indicated that 83.9% of the subjects improved at follow-up visits compared to baseline. 90% of subjects reported that they were satisfied. The physicians had 85% satisfaction. Side effects in the study were primarily erythema and edema, which resolved within a few days for most subjects. Early on, when we were trying to get the hang of it, we had a little bit more edema, and pain scores range from 2 to 9 with an average score of 5.7. There were cases of petechiae in about a quarter of the patients. These seem to resolve within 24 hours for most subjects, and the incidence of petechiae reduced with subsequent treatments. So in conclusion, this novel 1550 laser was successful in treating facial wrinkles. A majority of subjects demonstrated a significant clinical improvement in as few as one treatment, actually, and definitely in 2. The side effects seen in the study were minimal and expected, and improvement in pigmentation and overall redness was also noted. Thank you so much.
Thank you very much. Excellent presentations. We have time for maybe a few questions for the speakers right now.
Before Dr. Kibble comes, I have questions regarding cryolipolysis. This is regarding the adverse effects. My specific questions are, what's the most common site for pH after cryolipolysis?
What is the most, I'm sorry?
We can't hear.
Sorry about that.
What's the most common site for pH?
For
pH adverse effect after the cryolipolysis, and the risk factors. What are the risk factors for this? Is there any way we can find out so that we can avoid treating those patients with respect to BMI or age, or and liposuction versus surgery for treating pH? Those are some of the questions.
So, forgive me because I'm going to have to answer this independent of what the research is about. But from my experience, and this is, so my experience goes back to 2010 because we were one of the early adopters of the device. And so in my experience, we have seen one pH, not that we were lucky perhaps, but it's not a high incidence. The place we've seen it was the upper back. And so, and is somebody more specifically, typically from our experience, we can't tell you, and also one other thing that I was on the risk, I would say complication panel or committee for CoolSculpt a while back. But this is not a common occurrence, but I don't think there is, anybody knows really who is more susceptible to that because there are no studies to support it. Yes, liposuction is one of the ways to try to correct that. It's actually most effective way of treating the PIH. And you asked me one more question. Is that correct?
My understanding was because it's a fibrous tissue, so
Yes.
liposuction cannot really
It is
help.
tough to do it with liposuction, but it's still, you can still do that. The fat is a lot more fibrous with the PIH.
And can they develop pH even several years after cool sculpting? Let's say 5 years later, somebody comes to you and say, well, I have a pH. Is it possible?
I have never heard of that, to be honest. Yes, usually it is, what you see is something happens, weeks or months afterwards, but not beyond that.
Hi, great talks. For Dr. Doherty, I love that laser. That's the picosecond alexandrite. All my patients say they look smooth and bright and sometimes tight for just that laser alone. But you actually said people experience some side effects up to 15 days later. My people have like no downtime except for one complication. So is there swelling? Like I'm not generally seeing swelling, maybe pink the day of treatment, but the next day, 90% of people look normal.
I agree with you. I think those side effects are fairly minimal and probably a little accentuated in the study, but very well tolerated. In my experience is your experience as well.
Okay,
John.
and then I have this other side effect that, to my best estimate, I've done thousands of patients, it's about 5% of people get these things. I call them picopapules. I think it has something to do with the LIOBs. I've been pre-treating people with an antihistamine. I was using minocycline, but I'm trying to be a good antibiotic steward. So I've tried antihistamines and sometimes topical low-potency steroids just for a short course, and that seems to work. Have you seen these picopapules I'm describing?
I
Little
have,
red bumps?
Yeah, and I use more abrasive cleaning. I use clindamycin pads. I think that for me are effective pre and post, and topical steroids as necessary. So similar things that you've used. I think they're minimal, but they need to be discussed with the patient beforehand, so there's no physical manipulation of them, because I think that
Yes,
can,
if they
right.
go to squeeze them,
Right,
then they're in trouble.
right.
And they're not really pimples, and I don't think it's a
Right.
purge. I think it's because of this plasma bubble sort of
Right.
intraepidermally.
Right.
Yeah.
And so I describe them as, well, things are happening. I think there's activity in these layers, and sort of describe it as that beforehand, so they're somewhat anticipating them.
Excellent. Thank you. And for our metabolic device, visceral fat, super exciting. Most of the people are taking, you know, the GLP-1s, GIP, and now with the triple G coming, we are melting visceral fat, and people like me are wearing a glucometer. It's the Apple Watch of metabolism, so I can know exactly what's going on when I eat, and then I get up and run around when my sugar spikes. So I'm curious, why would we do a device instead of pharmacologic therapy? And then don't you think we need to combine it with lifestyle and monitoring glucose with CGMs or insulin level? But I do have to congratulate you for measuring leptin levels. That was super exciting. Oh, so why should we use a device when we have these magical drugs?
Why use a device why did you choose to use a device to modulate metabolism when we could use drugs?
We now have drug therapy that reduces visceral fat 15 to 20% if you can achieve optimal dose.
Okay, and the problem is that we don't use in any other thing than the device. The device is a special device with very big amount of energy, and the people don't say don't make diet, don't make exercise, nothing. Lose this amount of fat and don't have inflammation. For us, it's very, very important. We continue with this line, and this moment the cardiologist and the rehabilitator people in the hospital 12th of October in Madrid is very interesting to continue to work
It's a
on
good
this.
tool, good tool. Thank you so much.
Thank you.
Real quick, Dr. Murati, in terms of cool sculpting and doing that many cycles at one time, how do you guys juggle the massage?
Oh,
The 2-minute massage for each area, like do you have 50, providers massaging?
So that was all per, but in general, in our practice, when we do multiple, but we don't, the massage is only for about maybe 5 minutes or so. So it's just break it up really quickly. And we personally, I'm not advocating any devices because we had big massagers and so forth, but we usually use a Zimmer device in our practice. But I think that having done a study with one of the devices in the past, massage does make a difference actually from decreasing pain and so forth. Therefore, I advocate for that. But we do use a Zimmer device, but we used to use these big massagers or vibrating devices as well, which goes a lot faster because manually it's pretty tough and labor intensive, so we don't do that. I hope I answered your question.
Yeah, you did. I've heard of that device. It was more so the timing. I didn't know in the initial studies that, you want to get it done fairly immediately after you take off the applicator.
So you take the applicator off
Right.
and you massage the area, then you place the applicator on the other, if that's what you're asking me.
Yeah, because, doing that many cycles at one time,
Right.
I would think logistically, it's a little bit difficult to get that immediate massage. Like you take a cycle off,
It
you do
is.
you know what I'm saying? Okay,
Yes.
just was
No,
curious if
I
you guys had a
totally-
special trick for that.
I know, there isn't, actually.
Okay,
There
thank
is no
you.
special trick. Thank you for that.
Thank you.
Appreciate it.
Okay, great. Let's give a round of applause for our speakers. That concludes the session.